Have you checked yourself for diabetes lately? Well, if not, it could be a good idea to get tested, as 4.4 million people between the ages of 20 and 79 are living with the disease, which is a major threat to vision loss.
And the Ophthalmological Society of South Africa says early detection is key to addressing the issue. Dr Jyothi Srikewal, an executive member of the society, joins me now to discuss this further, or joins us rather. Doc, thank you very much for your time here on eNCA. I think, we've stressed so many times how important it is to get tested for diabetes, because it was considered, especially in South Africa, as the silent killer, because a lot of people actually have it and have no idea.
Absolutely. Good morning. Good morning, Janalik and Mashego. The incidence of diabetes is increasing with every day. More and more patients are being diagnosed. A lot of patients remain undiagnosed. A lot of patients present to our eye clinics with advanced diabetic retinopathy when they come to us, and that is where we can intervene and start earlier screening, start managing diabetes better for patients.
Now, doctor, if you are diagnosed with diabetes, is it enough for you to just go and have your eyes screened once in a while, or do you need a detailed examination of your eyes?
The World Health Organization recommends that every patient who is diagnosed as a diabetic should have a comprehensive eye assessment done. The purpose of this is to examine the front of the eye, the back of the eye, to look for effects of diabetes in the eye, which, if undiagnosed or untreated, can result in irreversible blindness.
Now, Doc, talk to us about some of the signs. In South Africa, we have, we always want to try and wait to see the signs first, or symptoms, before we get tested. We always wait to get sick. And with an illness like this, by the time you do get too sick, it's almost like cancer. It's sometimes a little too late. So what are the signs that people could look out for, or should they even wait for signs at all?
Absolutely. You should not wait for any signs. As soon as the diagnosis of diabetes is made, you make your appointment to see the eye healthcare provider. Very often, almost always, the early signs of diabetic disease in the eye is asymptomatic. There's no symptoms. People often always get symptomatic once the disease progresses. So you may not know that there's bleeding at the back of the eye. You may not know that things are going south there unless you have it checked out. But symptoms that do occur includes blurred vision, blood spots, seeing floaters, seeing cobwebs, distorted vision. Those are among some of the symptoms that our patients present with.
Now, doctor, some people believe that even if you have diabetes and you're having blurred vision, that it can just be fixed by wearing spectacles. It's not that simple, however. Unfortunately,
no. The spectacles fix the refractive error, correct? But, in diabetic retinopathy, it's the retina that gets affected. And the retina is the light-sensitive tissue at the back of the eye that sends light signals through the optic nerve to the brain. And if that, and I always akin it to like the engine of a car, and if that gets damaged, then whatever you place in front of it, it's not going to help with your sight. You have to fix the main problem. You have to address the main problem.
Now, Doc, you're an ophthalmologist, right? That's a specialist doctor. It's a specialized part of the field. And we all know, in terms of our issue in South Africa, in the South African context, we have proven that in the public sector, sometimes, that part of the healthcare fraternity is found wanting. And most of South African society actually is in need of public health, because it's very little of us who can afford private health. So, maybe let me give you an opportunity to speak to those who don't have private health and don't know where to go, which doctor to see, what to demand if they go to a public hospital to get tested for this.
Patients we need to change We need to change the narrative out there. Patients need to empower themselves, whether they go to a private healthcare facility or a tertiary center. They need to ask the doctor, do I have diabetes? What is my sugar level? What is my treatment? What is the name of my treatment? Have you checked my eye, doctor? No, I haven't checked your eye, but I've made your appointment at the eye clinic. Okay, so that's where we start. We keep to our appointments. We go, we get our vision tested, a dilated eye exam is done. We, as patients, we've got to empower. There is help out there. There is serious limitations, but we've got to empower ourselves. Ask the questions. Don't neglect your sight. Absolutely.
Ask the questions. Very important what you're saying there, doctor. But sometimes, Masego, we do not want to ask those questions because we are scared of the
Or we are not
answer.
intellectually able.
We don't have the vocabulary for it. But in your experience, doctor, why do you think it is that so many of us are afraid to actually look at what's really going on with our body, take a look at our health? Why do we neglect it, and why do we leave it until it is too late, as you alluded to earlier?
Multifactorial fear. People are afraid. They are afraid to hear the truth. There's limitations to access of care. And as you said, they don't know what to ask the doctor. We've got to educate, and you know, days like this, World Retina Day, Eyesight Awareness Week, it functions so well for us to spread out the information out there, what we should be doing for ourselves and for others.
Last one from me, Doc. You know, in 2019, the statistics in terms of people who had diabetes in South Africa, that was 2010, actually, it was at about 4.5% of the population. And then in 2019, it went up to about 12.7 to 13%. Is this because there was more people who were testing, or is it because we are actually seeing an increase in the number of people who get the disease?
I feel it's the combination of both, but more people are getting ill. More people are presenting to the doctors with high blood glucose levels. A lot of working class people develop diabetes and diabetic related complications. Yeah, I think it's a combination of both. And increased awareness as well. You know, we can't discount the lot of population that is taking charge of their health. So we need to encourage more people to take control.
Absolutely, and I think it's quite interesting that the statistics went up in 2019 when we started hearing around the world that there was a virus called COVID-19. And I think a lot of people, like you say, Doc, probably took their health issues a little bit more seriously.
Yes, yes. And that probably helped us diagnose more patients with diabetes. But, you know, it's so interesting. A third of patients who have diabetes, so that's in 1 in 3 diabetic patients will develop diabetic eye disease. And that is according to our statistics. However, it is interesting that only 20% of patients who have diabetes end up going to have their eye examined annually, regularly, for treatment or prevention of diabetic eye disease. So we need to increase those numbers. We need to increase the screening of patients who have diabetes. We need to increase the number of patients who go to the eye clinics, who have their eye examinations, because ultimately we hope to decrease blindness in our community. That is our ultimate intention.
Now, doctor, some people believe that once you know about a disease, or once you know that there's a sickness in you, then it gets worse. That's why they actually try and avoid it. What are some of the other myths that exist when it comes to eye care that you would like to debunk today?
Oh, we need days for this, but let me take this opportunity. So patients feel that they have blurred vision. It's because they are stressed. I can't see, but you know, it'll get better in a few days. Oh, I don't know why I suddenly can't see. I used to see last week, but I can't see this week. So they ignore the symptoms, they ignore the signs. They feel that if they stop their medication, their diabetes medication, their vision will get better. They feel if they stop taking their insulin, the insulin is making their eyesight worse. So those are small misnomers that need to be corrected in our community.
Well, thank you so much for your time this morning. My
yes,
apologies
thank you.
for interrupting.
We could talk for hours about this. Sorry about that. Yes.
Absolutely. Very important information you're sharing with us here today. So if you can, go and get an extensive examination of your eye. Your health care is important. And if you don't know what to ask, watch this interview again on our YouTube channel or Google. Google
absolutely.
is your friend. That was SA Ophthalmological Society Executive Member Dr. Jyothi Srikewal.